Great. Hi, everyone. Thanks for those who have already joined. We have about 67 people on the call. We'll wait one more minute for those who have not joined yet to join, and we'll begin.
Honey?
Yes, Eric.
Hi, I've just talked to her, so she is just in another call, but I asked her to log in immediately.
Okay, great.
Yeah.
So we'll begin while we wait for Langi to join, our last speaker of the day. Thanks for everyone who has joined. Very glad to be here with all of you to discuss the very important issue of well-being and safety of social service workforce. We all hear about the issues around protection of children, including violence, abuse, neglect, exploitation, going up during the coronavirus pandemic due to all the containment measures. We hear quite a bit about the importance of essential workers. We hear a lot about health workers who are selflessly providing the very much needed support to those who fall sick with COVID-19. But we hear very little about the other set of selfless workers that are working to protect children and of course adults, but our focus here will be on children. We will not be able to tackle this very important issue of well-being of children without a safe environment for social service workforce to do their job well. So this webinar will be about the safety and well-being of the social service workforce. We'll have several presenters who will come on board and talk to us. In a minute, I will mention the outline. Before I do that, I'll just introduce myself. My name is Hani Mansourian, and I co-coordinate the Alliance for Child Protection in Humanitarian Action. This is the 9th webinar in a series of webinars that the Alliance has been hosting. This particular webinar is co-hosted by the Global Social Service Workforce Alliance, the International Federation of Social Workers, and UNICEF. And the objective is not only to present to you the technical notes that was launched last week on safety and well-being of social service workforce, but also to hear some examples from different country operations on how they have been working in a way that both protects children, but also protects the safety and well-being of the social service workforce. So we'll hear some very practical ideas and cases. And we'll hopefully have quite a bit of time at the end. We hope more than half an hour for question and answer, where you will be able to, unfortunately, the setup of the webinar doesn't allow for you to speak, for attendees to speak. So we encourage you to already start posing your questions either now or while presenters are speaking through the Q&A option on the webinar. Also, we encourage you, some of you have already started doing this, we encourage you to start introducing yourself through the chat function. So some of your colleagues, Yolande from Texas, Bashir from South Sudan have already introduced themselves. We encourage everyone to do the same, so your colleagues know who is on the phone. I would like to invite our presenters to just quickly introduce themselves and tell us a little bit about themselves. before we actually dive into the discussion itself. Amy Bess, Acting Director of the Global Social Service Workforce Alliance. Amy, do you mind introducing yourself?
Sure. Hi, everybody. It's great to be talking with you today. I'm Amy Bess from the Global Social Service Workforce Alliance. I just wanted to say a quick hi on video, and then I'm going to turn off my video while I present. But great to be here with you all today.
Great. Thank you, Amy. And Amy has been one of the pillars of the drafting of this technical note. I don't know if Langi is with us yet. No. Then I'll invite Rafiq to introduce yourself, please.
Hello, everybody. My name is Rafiq Khan. I work as the Chief Child Protection with UNICEF Ghana Country Office. Thank you.
Great. Thank you, Rafiq, and welcome. And feel free to say a few more things about yourself. Natalie, would you like to introduce yourself?
Hi, everyone. It's good to be here. I'm Natalie Macaulay. I'm the Chief of Child Protection for UNICEF Bangladesh. Many of you probably know me actually from my work with the Alliance for many years, but I've been in child protection for over 20 years now. And yeah, I'm happy to be here. Thanks.
Fantastic. Thanks and welcome, Natalie. Syed Mohammed Mustar, please introduce yourself.
Hello there, everyone. My name is Syed Mawismi, Syed Muhammad Mustar. I'm currently working with a social welfare department of Malaysia as Assistant Social Development Officer. I'm also involved directly with the under the supervision of the COVID-19 response here in Malaysia. So I've been working for about 12 years under the department. So it's I'm so happy to be here, and would like to thank the Alliance for having me here. Thank you.
Thank you, Syed, and we are very glad to have you. So if Langi is still not here, I'll just, oh, you're here.
Yeah.
Do you mind?
Hi, colleagues. Yes, thank you so much. And I apologize for joining in late. I was running in between meetings. I'm Langi Malamba. I'm the 5th Registrar of the South African Council for Social Service Professions. I'm a social worker by training for the last 30 years now, and I've worked in different settings, NGOs, almost all my life, you know, as a social activist, working on gender issues, working on HIV mainstreaming and disability mainstreaming. And currently I'm dealing mostly with, you know, government coordination of the NGO sector as part of the portfolio for the Ministry of Social Development. There is a COVID response that was set up to make sure that we can, you know, manage to arrest the spread within the country.
Fantastic. Thank you very much, Langi, and we're glad you joined us. We were getting a bit nervous that we won't have the pleasure of listening to your interesting insights. Annie, would you like to introduce yourself?
Thanks, everyone. It's great to see some of our friends and colleagues that we have worked together in the past joining this webinar. We hope you find this useful. I'm going to moderate the Q&A for today's webinar. I work in UNICEF in the headquarters in New York and on child protection system strengthening. And for UNICEF, one of the key pillars of child protection system strengthening is strengthening the social service workforce, which is really at the heart of all the child protection work that we do. And I'm the focal point for that work in UNICEF. Thank you, Han.
Great, fantastic. Thanks, Annie. And again, Annie has also been one of the pillars of the development of this technical note. I also want to quickly introduce Ari and Nicole, who have been both also instrumental to the development of the technical note, but also for this webinar. They will not be speaking, but Ari, do you want to quickly just introduce yourself?
Oh, thank you. Hi, my name is Eri Meides. I work for the UNICEF East Eastern and Southern Africa Regional Office. We happen to be involved for the development of this guidance not from the very beginning. So with partners, I'm very glad to have this opportunity.
Thanks, Ari. And last but definitely not the least, Nicole.
Hi, everyone. Good to be with you. I'm the communications consultant supporting the Global Social Service Workforce Alliance.
Fantastic. Thank you, everyone. Without further ado, I would like to hand over to Amy, who will walk us through the technical note itself. Over to you, Amy.
Great, thanks, Hani. So as Hani has mentioned, today we'll be talking about the role of the social service workforce in responding to the COVID-19 pandemic and ways to ensure that the workforce is equipped, empowered, and protected during this time. So next slide. We at the Global Social Service Workforce Alliance work together with UNICEF, the International Federation of Social Workers, and the Alliance for Child Protection and Humanitarian Action to develop a technical note that hopefully you've all seen on the workforce in the COVID-19 response. We took into account global standards and guidelines in its preparation, and also utilized a survey of frontline workers to hear about their experiences. We all see COVID-19 as not only a health crisis, it has created a much broader social crisis as well. The pandemic has further exposed social inequalities and has added layers of vulnerability in every country it has touched. People who were already disenfranchised have been the most heavily impacted by the pandemic. A weakened economy, closed schools, and increases in mental health issues have severely affected families. Most countries have experienced increased reports and disclosures of child protection incidents, as Hani had mentioned earlier. Children are also being sent home from residential care institutions, detention, or other group housing situations, often when family-based care hasn't been fully or adequately organized so quickly. The social service workforce is being called on now more than ever to address the social outcomes of the crisis at a time when service delivery is more challenging than ever. The social service workforce is under intense strain to maintain their current work with vulnerable populations while at the same time responding to new demands. They're experiencing a large increase in their workload and are at this time to services safe. Support to children and families may still require in-person visits, posing a risk to the worker and families of contracting the virus, especially when adequate protection isn't provided. So we all know that the strains are there, but we also know the strength and passion of this workforce to rise to the occasion. And we've seen countless good examples of ways that they're continuing to get the work done and ensure that families and children have the support they need. We'll hear more about some of those good examples today. This current response also provides an opportunity to create stronger support around workers when they need it most. It's also a chance to bring together the expertise across the humanitarian and development space, where all have important experiences to contribute to organizing an effective response to this pandemic. So we all know this is going to be a long haul, and we need to be thinking about work together to strengthen systems of care, even while we respond to immediate needs. So I just want to preface the webinar with a brief overview of the definition of the social service workforce that was developed a few years ago with input from social service workers and organizations around the world. And just to highlight that this definition is a large umbrella that encompasses a wide range of workers, including but not limited to social workers, child and youth care workers, community development workers, child protection officers, senior welfare officers, social animators, case managers, just to name a few. In terms of roles, it's important to note that social service workers play a range of roles at the micro, meso, and macro levels, and that these roles have promotive, preventive, and responsive functions. This is further outlined in the note, but one worker's job may entail roles at different levels. For example, a community-based child protection worker carries out important meso-functions at the community level, such as raising awareness about staying safe from the virus, while also identifying and providing services directly to at-risk households. And this work would be considered micro-level. So you'll find more information about the specific roles that workers play in the response to the pandemic in the technical note. But just as some examples, some promotive roles include advocacy for the workforce to be considered essential. And this is being carried out by many professional associations of social work across the world with good success in many places. And some preventive roles include providing psychosocial support, staffing child helplines, contact tracing, among others. And some of those important responsive functions include continuing to carry out important child protection roles, especially as many countries have experienced a tragic uptick in reports of child abuse, neglect, and exploitation. So a set of priority actions were identified that are applicable to governments, NGOs, supervisors, and workers themselves. I don't have time today to go into detail on each of these, but detail is included in the technical note. On today's webinars, our presenters will be touching on different actions included here, and we may also be hosting future webinars on some issues such as self-care, which won't be touched on quite as much during today's webinar, but are very important. So I now invite you to listen to this selection of presentations and examples of some important work to address the social impacts of COVID-19. And I invite you to engage in ongoing conversations about how to learn from one another during this pandemic by joining the Global Social Service Workforce Alliance and sharing your challenges, expertise, and innovative solutions with others. Thanks so much, and back over to you, Hani.
Great, thank you very much, Amy. And just to emphasize on that last point, thanks for bringing it up, the idea that this note is just the beginning. We know that the pandemic is evolving. At the time when this was developed, we didn't know everything. We probably still don't know everything. So your feedback to us will help us if there is need in the future for revision, to be able to do the revision and help. And your feedback to us will help others who may also have faced the same challenges that you're facing in your work. So please do reach out through the Social Service Workforce Alliance or through the Alliance for Child Protection and Humanitarian Action. We'll hopefully distribute a link where you would be able to provide any feedback that you may have. Great, so I will hand over without further ado. Actually, I will just do a reminder. Please, if you have questions, use the Q&A option within the webinar. At the bottom, you will see two bubbles basically that says Q&A. You can post your questions. It would be better if you start posting your questions now so we can categorize them and try to address them as soon as possible. Over to you, Langi, to tell us about your insights. We are eager to hear.
Thank you. Thank you, Hani. I think it's important that I share with colleagues just the evolution of council as a statutory body, that since 1978, there has been an interim council in place, which was looking only at social work issues. Only in 1998 did the first council get established, which was all-inclusive. It looked at all emerging occupations together with the existing profession of social work, so your child and youth care work, and was inaugurated, for example, during the tenure of the second Council for Social Service Professionals. So in 2005, we saw the establishment of the first professional board, child and youth care work, but at that stage, no registration of practitioners took place because the board was still busy to find its feet and look at setting up regulations and making sure that the profession will become legally professionalized, where people can be licensed to practice. In 2010 to 2015, it was the third council, and there was the board, social work in existence, which was the third board, social work, and the first board, the second board for child and youth care work, and so on it goes. So this year, we have actually declared that the 2020-21 financial year to become our election year. Unfortunately, when COVID erupted, the plans of council had to be abandoned because it requires us doing aggressive education in the 9 provinces, which would then interfere with the protocols around social distancing and large group gatherings. So during this year, we're going to be looking at alternatives. Actually, the council has met a week ago and during a virtual meeting and took a resolution that we defer the elections until the minister pronounces differently. So we will continue to sensitize people about the value of actually, standing to be nominated to serve on council, because it requires active participants. We don't want the council to be stagnant. So the people who must stand to be nominated must actually start also becoming actively involved in the issues around advocacy and lobbying, and also understanding the connections that they must have with their sector. As a council, we have a vision that talks the language of unity and excellence, because we know that over the years, there's always, us and them syndrome permeating the work where we be operating in. Council is committed to transform the social service sector into a united workforce, regardless of whether one is employed in non-governmental organization or within the government sector. We are there to make sure that the scopes of practice, clearly delineates the roles and how we can work in an integrated fashion. Slide 3, please. So our mission is to serve the best interests of the social service practitioners, the professions, the service users, by regulating, leading, and promoting in a very innovative and responsive manner. And council has really outdone itself during COVID by, doing or adopting a humanitarian approach, where as a statutory body, we actively mobilize for resources to make sure that our NGOs or not-profit organizations that are going to continue offering frontline services have proper, self-protection kits to make sure that they don't become vulnerable. We heeded the call of the president, and as council, we had to announce to our sector to say, if you are out there and you are ready, you are protected, you've got your PPE, please do not shy away from taking up the space, because the president has actually acknowledged provide psychosocial interventions in communities. We offered guidelines to promote the use of alternative platforms, because we know that with any new way of doing things, there would always be ethical dilemmas. So when people start to use virtual platforms and people are using counseling and so forth, we needed to step in and give guidelines to say, if you do it, these are the parameters within which you do it. If you have to claim from medical aid, this is what you can do, this you can do. We also mobilized over 16 million rands worth of training and disaster on disaster management, trauma debriefing, psychosocial interventions, targeting the unemployed, newly qualified graduates, because our reasoning is that we need to start building a workforce for the future. A lot of us would be going on pension very soon, so we need to start making sure that we invest in the young graduates and empowering them in the unlikely event that we have another catastrophe in the future. So we have training that is being led by some NGOs to make sure that young people are exposed to this kind of training. And there is PPE that is offered, close to 30,000 hand sanitizers, masks, washable masks, gloves, surface sanitizers were distributed to non-governmental organizations, homeless shelters, local municipalities, our South African Defence Force social workers, and the National Department of Social Development, and also provincial offices. So council has stepped in outside of its normal legislated mandate to adopt this humanitarian approach to say, services can only be rendered by our practitioners, and if we don't look after them, if we don't make sure that we advocate for their interests, especially the non-governmental social workers and child and youth care workers, we would be leaving them to be vulnerable. So the council has those legislative mandates to register people, to make sure that there's quality education, training and development, and ongoing continuous professional development. We also have a mandate to regulate, professional ethics, the upholding of professional ethics and the conduct of practitioners. So we realized as council that during this period from middle March to the end of April, that a lot of our social workers or practitioners, child and youth care workers in the far outland. So we extended to show that we are a caring council. We're not only focused on our statutory duties, but we connect with the issues. And in that way, we are bringing to life our mission to be responsive and innovative. So we made an extension. We made sure that registrants can still submit their applications online, and we had a total lockdown of the office of council, but we allow people to still send their applications so that we can continue to legalize their practice. People who are in private practice, newly qualified graduates, they can also be registered. So as council, in closing, I just want to say that we're playing a very meaningful role advocating and lobbying different ministries on issues to make sure that safety of the workers, the healthcare workers, social workers in healthcare, social workers within the police, the military and so on, are taken care of. We're looking out for our child and youth care workers, our community development practitioners, to make sure that as they venture out there and are willing to brave it out and say, we are here for our communities, they are taken care of. And we are contributing to policy making as well. And every time there's a directive announced or pronounced by the president or the different ministers, which impacts the work of our essential frontline workers, as council, we unpack those guidelines and create a guideline through a board notice or a general notice that we send to our practitioners to make sure that they understand exactly what is expected, and we maintain compliance and service excellence at all times. Thank you, Hani.
Thank you very much, Langi. That was a very interesting presentation of how you dealt with ensuring that the services are provided, but also that the workforce is safe and can do its work to its best. I just want to once again call upon everyone to please continue writing your questions in the question and answer. It's really heartening to see that about 130 people on this webinar, and just with a scan that I did in the chat box, I see more than 30 different countries represented. So I hope that you all take these lessons back with you and share it with your colleagues. I would like to, and also Langi, thank you very much for finishing in less than 10 minutes. And I would like to invite all the other speakers to also follow Langi's trend. And now, Natalie Macaulay, Chief of Child Protection, UNICEF Bangladesh, floor is yours.
Hi. Yeah, there's my PowerPoint. Hi, everyone. Yes, I'm about to talk about the Bangladesh experience so far in COVID. We've had quite an extensive experience with strengthening social service workforce. The focus before COVID, if we go to the next slide. The focus before COVID really is that social service workforce was not that strong, and we really were focusing with governments on how we could expand and strengthen the social service workforce. We have basically one social worker for every 100,000 children. So if you look at Dhaka, for example, Dhaka City, we only have 2 government social workers for 20 million people, and that's around more than 10 million children. So the social service workforce was already quite stretched prior to COVID. We also have institutions and children in detention quite a lot. We don't have a formal foster care system here or formal alternative care system. We need a workforce of around 80,000, and we worked this out prior to COVID, so it's probably more needed now. And there's only just over 3,000 government social workers across the whole country. So within the COVID experience, the Child Helpline, 1098, field-based social workers and those working in institutions and places of detention were our most urgent need, because we didn't have social workers in every institution, and in the detentions there was only really one and maybe a psychosocial support worker if we were lucky. And at the field we were obviously understaffed. The Child Helpline also was quite understaffed at the time. Next slide. So the current situation and the concerns that we had our mixed data from UNICEF last year that illustrated that we had more than 89% of children that were in homes or certainly had parents that used violent discipline. And this was a concern for us as soon as they locked everyone down, because now we have 45 million children locked down in homes that use violent discipline. We also have 42% of respondents in the interagency assessment that said that they were beating their children more since lockdown, and they used the language of beating. The Child Helpline received 36,000 calls, so it was a 4 times increase, and I'll show you more data on that, across the time of April. And obviously we did not have a significant workforce in that regard when we first started COVID. We can see increases in child deaths and the extreme acts of abuse being illustrated through media. Birth registration was largely stopped. It's only just starting to continue now. We have reached over 37 million people via our Facebook and social media, but we don't really know whether the messages we're getting out there are actually being applied in everyday life. What we have used is messaging through our workforce, which I'll talk about a bit more later. And we've got obviously increasing concerns on psychosocial support, and information from the social service workforce highlighted that there was very limited spaces for women and children to go to if they did need to escape. And this is an issue, I think, in most countries, that if women and children need to flee a situation where they're locked down, they need to escape to somewhere that is safe from a health perspective, but also from a broader protection from violence perspective, and those places are limited. And we also wanted a quick release of children in overcrowded detention facilities and institutions because of the potential loss of life. But as pointed out, there hasn't been necessarily adequate planning of reunification and reintegration on the other side because of the limited social workforce. Next slide. So this is the increase in caseload from January to April. Like, it's stark, no? The January to February, they weren't really counting the caseload that they were following up in the field from the Child Helpline. But you're looking at less than a couple of thousand in January to nearly 40,000. So over 36,000 in April. So it's a significant increase across that time. Next slide. So our approach has been to ensure that the advocacy around social workers, that they're essential, critical and life-saving. This was critical within the first few weeks or even few days of the COVID response. As soon as schools were stopped, we had to make sure that social workers could still get out and access, and particularly with our helpline, do any rescues of children or interventions that needed to be done. So what they had to do is also make sure that there was a letter from government. We had to make sure that our government partners were able to get those letters out to the social workers so that they had that with them, so that they were able to leave their homes and access the caseload. We increased the number of social workers on the helpline. Now, this was critical straight away. We have doubled the Child Helpline call centre personnel, and we made sure in those first few weeks where people were totally locked down that they also had provisions for bedding and cooking and fridge, etc., at the Department of Social Services, so that there was a team that was able to stay in the building at that time. We also had to increase the IT support for the people that were able to take the calls from home and how they would adjust their case management system at home to be able to do that. We increased the number of social workers in key urban and field locations. We've only increased by 100, but with such a small workforce, it's actually had a huge impact already. We've increased the number of social workers in institutions. We've done a surge in the last week or so, particularly in places of detention, so that we can actually get the children out of detention now that virtual courts have been given the okay by the Prime Minister. We've also been developing lots of guidance and technical support documents based on feedback from the social workers themselves. We've been using a lot of IT support to get that feedback to us quickly so that we can start developing guidance for them, so they feel more connected, more supported. We've conducted online learning and training, including some level of supervision and coaching online. This has actually been more effective than we thought it would be, because some of our social workers haven't really used many of the technologies we're asking them to use right now, and they're learning. It's a big learning curve for them, but it's actually been very effective. By doing small groups multiple times a week, we've been able to reach most of the social workers in this regard. And as I said, we're increasing our IT support for online follow-up and for the call centre itself. We've also advocated for PPE for the social service workforce, varying from those in health sector locations who actually have to access people that have COVID, and those in the community. We've still got a long way to go here, because the sense and the feeling from the workforce is that they're scared, and they're actually scared to go outside. So we have to keep giving them the information they need so they feel confident to do their job, that they feel safe and secure. Next slide. One of the things we've also done is really start to promote social workers as this critical and life-saving, but also to make them feel better about their job, giving them a little bit more importance, honour in their work, because it really is life-saving and they're doing an incredible job. Our Department of Social Services and the government, is really helpful. Everything we're doing is with government. So this is all government strengthening of social service workforce, and the Child Helpline is also with government. And I think that this has also helped these social workers feel a lot better about their role and feel the importance of their role. Next slide. So we also have started the bi-weekly case conference calls with social workers and child welfare boards in each of the outreach areas. So that's 62 districts. We've also got the okay for the virtual courts for access to justice. This was done through a Zoom license, which now is working across the country, and actually has made two ministries work together. The Ministry of Social Welfare will have part of the licence, the Supreme Court's got part of the licence, the Ministry of Law has another part of the licence. And so the institutions which come under the Ministry of Social Welfare reach out to the Children's Court to do the application for the release of the children from detention. And this has been expediting the release of cases. Only in the last couple of days this has begun. There's also weekly capacity building and coaching calls with the social workers from the national level, but also at the district level. And there's a document series that we're producing on assessing gaps, capacity gaps. There's also places to sleep, as I said. So at each of the departments of social welfare, we're making sure that there's a place to sleep, eat, etc., so that call teams, but also social workers can actually stay if they need to, if they're unable to go home. Active case identification via various sectors and outreach, including education, and we're currently updating our referral pathways to include other new services that have come on board since COVID. Next slide. So these are just some of the guidance and support that we've done. I've put some of the English ones up there, but you can see the Bangla, they're all translated into Bangla. One of the things we're really trying to promote with our social workers is the look, listen and link. There was a big focus on cash distribution within our social workforce, and we're really trying to promote case management more broadly and that referral process that goes on. You can see down in the bottom right hand corner, this was one of our coaching, well, one of our capacity building calls that we had last week with some of the social workers in the field. Next slide. So our next steps really are that we want to continue this process of social service workforce strengthening. We want to build back better. We want to increase the capacity of this social service workforce, as well as the next cohort that's going to come through university level. We want to increase the amount of human resources in the field, so we need to expedite the increasing of the workforce as a whole, as well as trying to advocate with government to allocate some of the current social workers that work on other areas for children, women and children and families. We also want to strengthen the community-based systems, particularly the child welfare boards, so that they can expedite cases and they can actually refer very quickly. Increase the messaging around the importance of social service workforce, not just for the workforce themselves, but for other sectors, so that other sectors and life-saving sectors understand how essential they are. Enhancing the access to justice measures, linking social service workforce, including children in conflict with the law and those in detention, increasing that social service workforce in those facilities. Reduce the number of children in institutions, increasing the tracing and reunification and reintegration, but also really trying to push in that regard the casework and follow-up. So not just let's let the kids out and dump them. We know there hasn't been a lot of preparation with these families in advance. So we want to make sure that we do the work once they're in the back in the families and in the communities. And we're looking at creating service hubs, where we have permission now to create service hubs, child protection service hubs in urban areas for families and people that live on the street. Next slide. Increase the messaging on prevention and mitigation of harmful practices through the social service workforce. We've found that they are really inspired, and they get inspired when they're using these messages. They feel empowered when they've got messages to give the families that they're following up on, like tips, you know, like the parenting tips that we've all translated across the world. Doing this through our social service workforce has made them feel great, and when they make these phone calls, they feel more empowered. Strengthening online systems of case management and referral needs to be done and expedited for sure. This is the way we needed to go anyway. So again, this is an opportunity for us. Engaging the adolescents that we had in adolescent clubs. So prior to COVID, we had thousands of adolescents that attended clubs that were supported by one of the ministries, the Ministry of Women and Children Affairs and UNICEF. And part of that was that they also had child rights facilitators. And we are now looking at coaching these child rights facilitators to also be integral part of the social service workforce, linking back to the Department of Social Services. So they will be identifying some of the vulnerable adolescents and referring. Engaging education sector and teachers to identify the vulnerable adolescents and refer, but also to identify vulnerable children. So one of the things we have noticed is obviously there's not an easy way for people to ask for help, and the social workers have identified this as an issue for them, that they don't know how to find their cases, to reach out. And so we want to reach out to other sectors that may know about these children and be able to identify some of the children that are at high risk right now. And then also coordination of the child protection cluster and the subsector in COCSs to maximise the non-government social service workforce. So making sure that we're consistent with the messaging and making sure that we support the non-government social service workforce to be strengthened at the same time and supported. Next slide. And that's it. Thank you.
Great. Thank you very much, Natalie, for sharing this very inspiring approach that you have taken. With some of the examples that you gave are such simple things that you can do that will make this workforce feel supported and valued. So I hope everyone takes these examples and hopefully add to it. I just want to remind everyone that questions should be posted through the Q&A function. And Natalie, there's quite a number of questions both through the Q&A and the chat for you. So feel free to already go and answer.
Start answering them. Okay, I will do.
Great. And I'll hand over to Rafiq. And Rafiq, it would be great if you can keep it to 10 minutes as we are running over a little bit.
Thank you. Thank you very much, Hani. Hello, everybody. My name is Rafiq, Chief of Child Protection. Hani asked me to say a few things as well. I've been working in the child protection field for about 15 years now. With UNICEF for about 10 years. I was in Jordan for the Syria crisis, in Egypt for a regular program, and then for Libya crisis on the Libya-Egypt border as well. Now I'm in Ghana since the last 3 years. I'll get started. Next slide, please. Overall situation in Ghana is that we have 5,400 cases of COVID. We have gone through a cycle where there were restrictions on the movement, and even there was a partial lockdown in parts of the country. As you will see, the high concentration is in the south, especially the capital city, which is the Accra, Greater Accra region has 4,000 cases over all 5,000 cases. However, now the restrictions on movement have been lifted. However, there are still restrictions on larger gatherings of people, but you are free to travel from one place to another. Before the crisis, next slide, Nicole, please. Before the crisis, UNICEF has been working with the government of Ghana in supporting the overall social service workforce. On your screen, you will see on the left side social service workforce capacity assessment that we conducted to see what exactly is the situation in the country. In the middle is the standard operating procedures for case management for child protection to be used by the social service workforce. And on the right is the overall mapping of child protection services. So the situation is that we have around 60,000 people that who are engaged in the social service workforce in Ghana. Out of those, 2,800 are with the government, and around 58,000 are working with as para-professionals with different CSOs. So in this, our focus is going to be on the 2,800, that how critical they are, what are the functions that they perform, and how we would like them to continue to do that while maintaining their safety and well-being. Next, please. Next slide, please. Overall, with UNICEF's support last 2 years, for example, in 2018, 2019, just to put things in perspective, that what exactly are we talking about when it comes to the caseload? We support child protection related programs in 72 districts in Ghana and all 16 regions. There are total 260 districts. And then we supported the provision of services to around 10,000 children. And this is the case management services, which includes 2,500 children who suffered from sexual violence, child survivors of sexual and gender-based violence as well. The last table is on the face-to-face number of people who were reached with better parenting programs or other child protection prevention programs. So this slide basically brings together the different functions of the social service workforce, starting from promotive, preventive, and responsive functions. So this is before COVID. So next slide, please. So our priority was that how do we make sure that there is continuity? At least we reached this number. But then this week we conducted a survey, which lots of people have been saying that the abuse is on the rise. We wanted to see how families are coping and how the situation is inside the home. So this is the U-Report survey. It was released on Monday. I took the results yesterday. It is still open, but this is the kind of a reflection where we are. Over 1,000 people had responded when I picked up these results. Do you feel that your parents and caregivers are treating you more harshly than before? And 32% children and young people said yes. Did your parents or caregivers shout, yell, scream at you or your siblings during the last 2 months? And 46% yes. Next slide, please. And then there are other questions around the violent and abusive behavior. The questions have been asked in a different way, but the answers are almost coming to the same percentages, which is over 30% of children and young people have reported that they are experiencing more abuse at home or seeing more abuse at home than what it was 2 months ago before the lockdown started on 14th of March in Ghana. Next slide, please. Now, add to that, there are two more challenges that we know from our conversation with social welfare workforce at the district level, at the regional, at the national level, that fewer families are accessing the services that they were accessing before. And we have more children that who are suffering from violence, more women who are probably going through the domestic violence aspect, and children are both victims and witnesses of domestic violence. So let's not just really forget about that as well. And then there are fewer kids that who are actually accessing services. And we have an example. Just a couple of days ago, we heard that one of the child-friendly gender-based violence courts, which only hears cases of sexual violence against children and women. There were a couple of suspected infectious cases of COVID, and the court has been closed down. All the cases which were going into the hearing, now they have been put on hold for 2 weeks. And there are social workers that who are actually support the court proceedings by writing the social investigation reports, for example. So these are kind of challenges that are there. How do we ensure that we continue the services that are very life-saving in the case of sexual violence and in many other cases as well? And we also protect the social service workforce. Next, please. So from UNICEF, what we have been doing, that we wanted to support the social workers in making sure that there is a continuity, but not putting them at risk. This is one of the sessions from this week, for example, from one of the upper west regions in Ghana, where child protection team members from that district are engaging with women who work as petty traders in the they call market women in Ghana, that they should not bring their kids with them. So this is if you see the social distancing component and the social welfare workforce person having a mask, can we do that? Can we, for example, magnify that? Next slide, please. So basically, this is what is coming from the social service workforce as well. So as a first step, what we did, we provided some technical support to the government to finalize these two very short, brief documents. One is the special guidance note on child protection case management, to see the cases which already are being managed, how the social service workforce should deal with that caseload. And then, of course, think about what is coming next, 33% of the addition, which we just spoke about. The second guidance is about the key messages that the social service workforce should deliver when they are talking to the clients. So if you are providing a psychosocial support, you have to provide information around COVID as well as around helplines. So I will explain a little bit more in the following slides. Next slide, please. One of the key elements, for example, that how should we ensure continuity and well-being of social service workforces, that letting them know that the caseload that is currently with them, how they should handle that caseload. And this is what we came up with in Ghana. So if the case is a low risk, do it by phone. Even if it's a medium risk, do it follow up by phone. If it's a high risk, then visits can be done, but they should be done with precautions. Precautions are, of course, then you have a hand mask, you have a gloves, you have a hand sanitizer, and other aspects as well. And then basically the visit is allowed. But in other cases, absolutely, government of Ghana has approved these guidelines, which are in line with the standard operating procedures. And this is the one which we are now pushing down to the districts. So all the social workers workforce actually is following that. So it keeps a balance of continuing the service as well as making sure that we are not putting social service workforce at risk. Next, please. Further, there are already hotlines or helplines existing in Ghana, and we work with those existing hotlines already. There are basically two types of hotlines. One is dedicated for domestic violence, which is with the Ghana Police Service. One is with the Ministry of Gender, Children, and Social Protection, which is the helpline of hope. Anybody with any concern which is related to social service workforce, they can actually call on that. And there is an increased number of people who are actually calling on that as well. Next slide, please. We have also incorporated the hotline messages and key CP messages into the overall RCCE material, which is the risk communication material being done by UNICEF. That's also included at the bottom, the helplines. Thank you. Next please. We have provided the personal protection equipment to all the social service workforce working with the government of Ghana. We have covered 3,000 social workers. As I indicated earlier, there are 2,800 social workers, but we have also covered the staff who are working in the court, as well as the staff who work for birth and death registry, so that they can continue to follow that matrix which I showed, and they can continue to be in the field. Next slide, please. They can continue to do what they do, but maybe they can adopt some new ways, maybe use community radios, just like in the picture that you see right now. A social worker basically in a community radio talking to the community about different parenting messages as well as COVID information, and also mixing it with some new methods. Next slide, please. Which is the way we used to do things. But you will see, for example, the para-professional does not have a mask, but it's a rural area, open air, and people are spread around in a circle with the appropriate social distancing. The whole COVID crisis is a challenge. The whole presentation that I presented was to address that challenge by making sure that how do we continue at least continue the provision of services by keeping the social service workforce, and if we can scale that up as well. Thank you very much. Medasi from Ghana.
Thank you very much, Rafiq. I will quickly go to Sayed, just because we're really running over time. And Sayed, I would appreciate if you can keep your presentation to 10 minutes or less. Over to you, Sayed.
Well, thank you so much, Hanif. It's a privilege to be here, to be given 10 minutes for sharing the response of social service workforces here in Malaysia. And I've been assigned to be focusing on specifically in supervision. So before that, let me give you a brief situation here that happens in Malaysia. So in the next slide. Yeah, actually Malaysia is under the Movement Control Order, or we call it MCO. It's more like a partial lockdown beginning March 18th, 2020. It is under the provision of Prevention and Control of Infectious Diseases Act, 1988. And it's been imposed nationwide. Yes, and centralized action under the National Security Council and also the Ministry of Health in Malaysia. So for the social services, the majority of the workforces is under the Social Welfare Department. So the social service workforces here is gazetted under the Act to be among many of the authorities and agencies responsible as a part of essential services. So we are given opportunity to provide services during this partial lockdown. And when we are providing these services, we are focusing on two major clusters, which is firstly is the non-COVID-19 clusters, which is considered, which comprises of existing clients, for example, like children, elderly, and person with disabilities, community, and etc. And also the other clusters is COVID-19 related clusters, which is which comprises of person under investigation, person under surveillance, their family members, and also those who directly or indirectly affected due to the pandemic. So we move on to the next slide. So as a social service workforces, there are several issues being addressed during this pandemic. First of all, we need to identify the clusters so that we can provide appropriate intervention, and also we could continue with the services towards our clients. And during the intervention, we need to adhere ethical social work standard based on ethical and moral obligation. And also, at the same time, we need to ensure safety and good hygiene practice standards. And these practice standard is based on guidelines, regulations, and protocols being imposed by the World Health Organization and also Ministry of Health in Malaysia. Because we are moving into a new sudden change of environment, so social service workforces are acquired to gain related knowledge to be used during the intervention. Because some of them, we need to keep abreast with latest information and also guidelines, instructions, and protocols during providing the services to the clients. And also, we need to acquire a rapport and interpersonal skills when we need to allow effective information transfer between agencies. And at the same time, because when we move into the new environment of service, so we need to equip with latest technology that will allow the social service workforces to work remotely at the utmost efficiency. So we move on to the next slides. So I will go very briefly about the response during this pandemic. So here, as I mentioned earlier, there are two clusters, the non-COVID-19 clusters and also the COVID-19 clusters. So for the non-COVID-19 clusters, it starts in initial contact, which via referrals. So it's to ensure the genuineness and also the severity of the cases. Then we will try to move on to the intervention, whether it be in online platforms such as emails or phone calls or even social apps. And some of the cases maybe require more face-to-face intervention, so we need to provide teleconferencing mode in a private setting to ensure privacy and confidentiality. And also some of the cases with severity need to be in person, so we need to provide in-person intervention because of the severity of the cases. And then we need to put in documentation and also filing for further planning. A bit different with the COVID-19 clusters in the next slide. Okay. We start with initial contact also, only that the referral is normally via Malaysia Defence Civil Workforce and also the Ministry of Health. And we need to have a collaborative networking with these two agencies because we need to provide all the details and information to assist them with the tracing and also data collecting for COVID-19 patients and also their family members. And we need to also adhere to the zoning area, whereas all the social service workforces is under the green and yellow area, whereas if we need to go to the red area, we need to don the full equipped PPEs and also some more strict protocols that we need to follow to. And the same is the intervention is the same, only that the setting is even stricter and also specific to ensure the privacy and confidentiality of the clients. And also the documentation, also we need to work closely with the National Security Council and also the Ministry of Health. So we move on to the next slide. So now, as supervisors, so among the practices that we need to implement during the COVID-19 is that, first of all, we need to have a regular remote meetings with the social service workforce under our care. So it starts with morning 5 to 10 minute sessions to communicate, to brief the social service workforces with latest updates, information, guidelines, and protocols that keeps on changing, sometimes on daily basis. So we need them to be aware with what is happening and what are the new findings, what are the new information that they need to acquire or adhere to. And also at the same time, during this session, we need to set goals and then also set the outcomes to be achieved in that daily on that specific day. At the same time, during this session also we try to plan what are the intervention that going to be provided to the clients. And as the case management goes on, we always encourage to have casual talks. It's more like a very casual discussion to be conducted. We try to give liberty to our social service workforce to work on their discretion, but sometimes they maybe need some reference or maybe some further perspective on how to deal with the cases. So we try to put it in a very casual way so that it doesn't seem like very strict, but it's more like a sharing ideas and also a perspective during the case management. And towards the end of the day, we also provide the debriefing session is to discuss any findings, any issue, or getting any feedbacks from the case that has been managed by the social service workforces. And also perhaps we need to set plans for tomorrow. So what are the plans and what are the further action that needs to be taken after we gather all these findings and issues during the case management. And for those cases with high complexity and also solicitation, so as supervisors, we always encourage to have professional collaborative strategy. Yeah. One of the ways is to have a supervised intervention, which is the social service workforce is having an intervention with the client with the presence of a supervisor. It's more like group discussion on how to deal with this client and how to provide better intervention towards the clients. And also we have some monitoring, meaning that the social service workforces may need to prepare online self-administrative report to the supervisors, and we try to monitor the progress of the case that's being managed. And also some of cases, for example, for child protection cases, we need to have some inter-agencies collaboration. We need to work cross-silo, meaning that, for example, we need to work with the local authorities, we need to work with the medical practitioners. So by having this inter-agency collaboration, we would come up with a better idea, better perspective, and we can exchange ideas and expertise to come up with better intervention towards the clients. So the next slide is, okay, this is very important, is to have a self-care practices. So during supervision, we need to ensure that all the social service workforces to practice self-care. So commonly we know that we need to practice social distancing. So over here, we need to make sure that at least we stand about 6 feet apart from one another. And even when we try to have an intervention, this social distancing aspect need to be adhered, because it's part of the protocols of providing the interventions by the social service workforces. And also we also keep on chiming these 3C practices, is to remind the social service workforces to avoid, first of all, the confined spaces, meaning cannot be too many people in a very small area. And then also we try to avoid crowded places, so that meaning that we cannot be around in a very crowded place where there are many people over there. And also the close proximity conversation. So when we're having the intervention, we need to make sure that the social distancing of 6 feet is to be adhered. And also there's another practices that also being applied recently is the 3 Ws, which is the wash, wear, and also warn. So wash is to practice good hygiene standards, meaning we need to wash the hands, we need to use the sanitizers. So we need to remind the social service workforces to adhere to this practice. And also wear, like having a PPEs, a standard full PPEs, proper PPEs when we have to deal with the clients. So it's to ensure the safety of the social service workforces, and also we need to warn our social service workforces about what are the do's and don'ts when we try to have these interventions. And also, we need also to take note on the
I
self-well-being
apologize,
of the
Syed.
social.
I'm going to ask you to please wrap up if you can in 1 minute. We're really over time. I apologize for that.
Okay, thank you. Okay, it's okay. So above all, it's still it's still something new here in Malaysia. We're not saying that we are doing it perfectly, but we try to keep on progressing towards coming out with a better solution or better approach in dealing with the supervision under for the social service forces. So we hope that in these coming weeks that we would help our social service forces to come up with better and a proper professionalism when dealing with the clients. So I'll pass it back to you, Hani. Thank you.
Great. Thank you very much, Syed. And I think Langi wins the prize for going less than 10 minutes. But really, thanks everyone for your contributions. I'll be handing over to Annie for the questions and answers. Just a reminder that questions should be posted in the question and answer function. And if you want to write to everyone in the chat box, you have to select the option that says all panelists and attendees. If you just do panelists, only the panelists will see it. Over to you, Annie. Thank you very much.
Thanks, Hani. And I'm looking at the clock on my computer, and we have about 15 minutes for Q&A. I think we have heard a lot about lot of great work about social service workers. One very interesting question that that has come up, which I thought we could start with, which we very often tend to keep towards the end of all our conversations, and that is about community volunteers. So a participant would like to know if any or all of the panelists could say very briefly about what is the scope of work of the community volunteers in this pandemic, especially in terms of social service workforce and child protection, and what are the things that need to be done in terms of enhancing both their skills as well as the protection for these community volunteers. So I would invite the panelists to respond, and it's for everyone to respond. So please go ahead. Amy, could we start with you?
Sure. Yes, it's a great question because community volunteers are such a critical part of this response, and they know the community members the best and who is most in need and who requires support. So it's been part of our efforts to ensure that we are reaching community volunteers. At the same time, we know that there's some community volunteers who have great access to technology and phones and can be reached that way, and then many who cannot be. So we're always looking at ways to better reach community volunteers. And in the preparation of the technical note, there are a lot of good examples that came out about how to reach particularly members of child welfare committees, such as those who are operational in refugee camps, and ways to work through community leaders who may have access to phones or other technology, and then who can be the relay point to members of child welfare committees, so that community volunteers are actively engaged in getting information and also relaying information about families who are in need of support. So maybe I'll stop there and let the others who are working at the country level chime in.
Rafiq, would you have any thoughts on this?
I think it depends on jurisdiction to jurisdiction how formal their role is. However, their contribution is no doubt massive, and they do in many countries, states do, for example, recognize their role, and even in some cases, governments actually pay CSOs to provide those services. And I know for sure that in Egypt that was the example in which paraprofessionals are actually recognized by law as a professional workforce. Thank you.
Natalie, have you have you noticed any experiences in terms of how the community volunteers' roles have changed over the in the current pandemic in Bangladesh?
What I've noticed is that it really hasn't changed at all. In fact, in a lot of locations, including in the camps in Cox's, the volunteers within the camps are still functioning pretty much as they were before. Obviously, there is increased emphasis on social distancing and increased emphasis on ensuring those sorts of health-orientated rules and regulations are in place, but they're still working the same. At the national level, through the social service workforce strengthening, we've been pushing for child welfare boards to meet more regularly, to look at particular cases related to children in conflict with the law, as well as those that are at high risk, including children with disabilities. Some have been functioning, some have not because of a lack of access to IT support. But the volunteers themselves in urban areas are also still working, and particularly those that are working with children on the street. Those volunteers, the non-government organisations and CSOs are still working. Yeah.
Thank you, Natalie. I'm going to actually move to the next question, and Said, if you don't mind, I'm going to direct this question to you. Because there was a question about documentation tools that are used in the current situation, and it was specifically asked to you, but I think it is a question that is relevant across different contexts as to how do you use documentation tools more effectively, especially when you're moving or shifting most of your operation from fairly offline paper-based work sometimes to online formats and so on and so forth. So Syed, in a minute, if you could respond, thank you.
Well, thanks, Ani. Actually, over here in Malaysia, we already have our own centralized documentation networks that we can access via the internet. So it can be accessed anywhere nationwide. So during this, it's already existed prior to the pandemic. Actually, we've been using this platform for about many years now. So somehow when this pandemic somehow spread throughout the nation, and we started to move from doing physical documentation into the virtual documentation, and we have to work remotely. So we just use whatever that we have to assist us with the intervention of the with the clients. So it seems like it's a blessing in disguise, even though it's not a very perfect network, but actually it provides assistance and right ease for us to at least to come up with better documentation, better filing inside the network. So that's my answer, Ani.
Thank you, Syed. Thank you so much. I'm going to pose a question that is now more applicable to a host of panelists, and I think a couple of responses would be really useful. The question is really about how do social workers and social service workers reach the most vulnerable in the current context? What is it that we are doing differently now during the pandemic that is making sure that we can still reach the most vulnerable children? And for example, there is a very specific reference to children with disabilities, for example. How are child helplines, for example, changing their way of functioning or acquiring new skills, for example, of the helpline responders and counselors and so on and so forth to deal with the current crisis? So I'm going to open it up to all the panelists, and I don't like to call out individual people. So
I'm happy to speak.
Yeah, Natalie, thank you so much. Go ahead.
Yeah, look, I think it's an interesting question, and it's something that we've been thinking about over the last few weeks, particularly given that we know that most children are identified for a child protection system when people see them. And when people see that something is wrong, or they tell them, they get the chance to ask for help. So whether that be through the education system or other families and parents that they might be interacting with, sports coaches and the like, religious leaders. So at the moment, obviously, they don't have that network. They don't have that web of protections. They don't have that opportunity. And we've even noticed, even with our call centre calls, that 65% of the calls are actually from boys. So there's a gender dynamic in being able to even access the technology to be able to call for help. So one of the ideas we are starting to pursue here is to look at those areas that usually you would get your reports from, whether they're teachers or religious leaders or other parents and families, what indicators were available to them prior to COVID that could identify risks in current families during COVID. So are there children and families that do have risks that before COVID that they can now tell us about, that we can now go up and follow up and make sure those children and families don't need any further services. I don't know if that makes sense, but it's like this idea that helplines are not enough, and we need to be able to give children and families many opportunities to ask for help. And the only way we can do that is really through outreach at the moment and identifying some of those with high risk. Children with disabilities, we have quite a good database here in Bangladesh, so there's been a follow-up on that. So we've been lucky in that regard. But again, teachers know the children with special needs, and they know the ones that were high risk before COVID. So we've been following up that way.
Thank you, Natalie. Any of the other panelists would like to comment on this?
I would like to give it a go. I think it is indeed a challenge. Even if we are making efforts, for example, I can give an example from the case of Ghana. I mean, Ghana has 39 million mobile phone subscribers. The total population of Ghana is 30 million. So the first thing that we are utilizing is the bulk messages, which are going to people. I mean, from different networks, MTN, Vodafone, Airtel, and with the information on the hotlines. Number one, number two. On the U report, then we have a chatbot, which is Ago. People can call a simple toll-free number to get access to the information as well. And then the district child protection teams are actually using community announcement systems. But I have no doubt that there will still be children that who are extremely vulnerable and will be left behind. So we need to be on our toes, which we are and will continue to be, to make sure that we are actually not leaving them behind. Thank you.
Thank you, Rafiq. There are some really interesting and important questions that are here in front of me in the Q&A box. I'm afraid we may not be able to answer all those questions here during this live chat, but those will definitely be recorded and responded to. One important question that has come up is about the collaboration and networks between health and social service sectors, for example, because it's clearly emerging quite strongly than ever before that there is an importance and there is a requirement that health and social welfare sectors talk to each other more regularly, and there are more formal engagement between those sectors. So any ideas, Syed, would you want to say anything, or anyone else, any of the other panelists who would like to say something on this? Syed? Hello? I don't think Syed can hear us.
Yes, Annie, sorry for that, because actually I'm trying to answer one of the questions that is specifically given to me in the Q&A question. So that's why I cannot answer to your question just now.
No worries. Thank you so much for responding to the question in the Q&A box. Now, the other important and interesting question is about child safeguarding. And there were some other questions where Natalie, you had responded to how are we using ethical guidelines and some work that is going on in Bangladesh. I saw your responses. Would you like to speak a little bit about what's happening in terms of ensuring child safeguarding during the pandemic response?
Yeah, I think, well, first of all, we've been doing training with our social service workforce, and in Cox's Bazar particularly, where we've got such an influx of emergency responders anyway, we have also got a PSEA network down there that is promoting the phone lines and the like. The phone line for PSEA is separate from the child helpline. And in all places where there are projects, there is the opportunity to respond and have any sort of complaint mechanism. There's posters and all sorts of things up in all those locations. So it's quite comprehensive in that regard. My worry is more about the isolation of children and their families right now, and how we can do outreach for those most vulnerable, because we do have 45 million kids that are living in homes where they use violent discipline regularly. And so we know that there is an increase of children that have died because of child abuse, and we know that there is an increase of child abuse reports. So the response for that is our priority at the moment. We do already have quite a comprehensive PSEA network and response in that regard for safeguarding. From an ethical standpoint, there's other ethical questions that are being asked, which is around the use of technology and how that impacts confidentiality, and how social workers can respond in different situations, and how they speak to children, particularly over technology, or communicate with the most vulnerable children over technology. And does that make those children more vulnerable? Of course it does. So those are the ethical questions that we're working with right now, and I don't know that we have all the answers to that, given that we still are under lockdown here, and that really most of the children can't be followed up face to face, where there may be another adult present. It's all online at the moment.
Thank you so much, Natalie. If we don't have any other panelists wanting to respond to it, I want to take up one more question, which is probably going to be the last question. And Eri from our Nairobi office, if I could request you to respond to this question in terms of what is the international community doing in terms of upholding the social service workers, protection measures in the context of this pandemic. Eri, would you like to say a few words?
Annie?
Yes.
Are you talking to me?
Yes, Eri.
Okay, so Annie, is that my question? My question to me?
Yes.
Okay, sorry, I thought you were saying my question to Natalie. So can you repeat, please?
No, there is a question about what is the international community doing, for example, in the sub-Saharan countries to really protect the social service workers in terms of from this particular pandemic, for example. So I thought if you had a thought on that.
So I think for it is broadly international community, so that was framed. For example, one of the things we are doing right now, so this webinar is also the part of the effort. Then this guidance notes, as it says, all the recommended actions are related to the protection of the workforce. So that is about providing some gears, the personal protective equipment, but also to facilitate the alternative modality for the service deliveries, such as remote service provision. I think it's really a combination of all of this. And also, in the region, we found it very, very important to make sure the workforce is considered to be essential service providers by the government. That will lead to all the support we can justify and facilitate for the workforce. Over.
Thank you so much, Eri. I think you raised a couple of important points, including how do you identify who are essential in terms of providing social services, and then how do you go ahead and designate those workers. On that note, I see we have only 1 minute left. I'm giving it back to Hani for the wrap up and the closing. Hani? Over to you.
Thank you very much, Annie, and all the panelists, Sayed, Rafiq, Natalie, Annie yourself, Langi, Amy, and of course, Ari, and Nicole for all the background work and support. It has been really a pleasure to hear all of the lessons from the work that you have done and all the very interesting adaptations you have made to your work. We could go on for probably another hour and still be questions and interesting answers, but we have to close at this point. We encourage all the attendees to take up the technical note and share it widely, and please adapt it to your context, because context is a huge part of how well these technical notes can be used. The video is already live on Facebook, so you can share it. We will also put an edited version of the video on the Alliance YouTube channel that can be shared with all of you guys. And we have a new attendee from Bangladesh. Thank you very much. We'll leave it at that, and we hope to see you in the next webinar. All the best and stay safe.
Thank you.
Thank you. Bye-bye.
Thanks, everybody.
Thank you.